Hey everyone, it's Dinah from the Health Insurance Insights Network. If you or someone you love has Medicare, this video is for you. Every year during open enrollment, we get flooded with calls, flyers, and commercials about plan options. It can be a bit overwhelming, but here's something a lot of people don't know. You can actually explore those same plans for free on the official Medicare website, Medicare.gov. Today, I'm going to show you exactly how to use it to look up Medicare Advantage plans, also known as replacement plans. This is a powerful first step to help you understand your options before you make a change and to make sure you're not missing out on something that fits your needs better. I know that navigating websites like this can feel confusing sometimes, especially when it involves your healthcare coverage. So, if the computer isn't really your thing, grab a trusted family member or caregiver to sit with you while you explore. My own grandmother used to call me with questions about her Medicare plan before she passed away. That was back when I was in my 20s. I was living in another state, but I became her little research queen. I helped her create her Medicare account, searched for her providers, and compared plans right from my laptop. And, essentially, that's what inspired me to start helping others do the same. So today, we'll go straight to Medicare.gov and I'll walk you through steps to search for replacement plans that are offered. I'm selecting Georgia today. Now, every state has different plan options, but the process you'll see today will be the same no matter where you live. In future videos, I'll highlight plans from some of the major managed care organizations like Anthem, Blue Cross Blue Shield, Humana, Aetna, United Healthcare, and Cigna so that you can see differences side by side. You can also go on the websites of those companies and they'll have access to their plans. So, as an example, if you already have an Anthem plan, you can go onto Anthem's website and compare all of their plans for 2026. But right now, we're going to jump into the Medicare.gov portal. Okay, so let's start right here at Medicare.gov. This is the official government website for all things Medicare. No sales, no third parties, just information that you can trust. At the top of the page, you'll see several options. Basic information, health and drug plans, providers and services. But we're going to skip that. Right now, it is open enrollment season. This is what you'll see on the page, and we are going to click on Find Plans. All right, so I do want you to click there. It does give you two options once you select there. If you have an account already, you can click here to log in. If you do not have an account, then you can continue without logging in. You just need to select the year and you need to select your zip code. So I am going to continue here. And then it gives us three additional options. Do we want to search for Medicare Advantage plans, Medicare drug plans or prescription plans, that's Part D, or Medigap policies, which are all supplemental policies. I am going to select Medicare Advantage plans. That's where we're going today. We're going to see what we can do here. Once you select Find Plans, it even gives you some other options because there are some reasons that you should log in instead of searching without um, all the information. If you have Medicaid, there are dual eligible special needs plans, and you'll need to be logged in to see them. If you have SSI, you're going to need to be logged in a Medicare savings program, or if you get extra help with your drug costs, you should be logged in so that you can learn more about those programs. I am for today selecting I don't get help for any of these programs, and I'm going to click on continue. All right. I have preloaded some drugs here for us. I'm going to remove the Humalog and show you why I added the insulin Lispro. Humalog Quick Pen and Humalog and insulin Lispro are the same medication. Humalog is the brand, insulin Lispro is the generic. Now I'm going to remove it, and then I'm going to add it back because I want you to see what populates when you're adding a medication that may have a brand and a generic. All right, so once I put Humalog in, it automatically populates this screen and tells me your drug has a generic. Humalog does come in a generic called insulin Lispro that may cost less. Would you like to add insulin Lispro to your drug list instead? I am going to keep the brand here. As you already saw, I added the generic. What I want you to do is add whichever one you're using. If your doctor has you on Humalog, I want you to add Humalog. If you are getting insulin Lispro instead of Humalog, I want you to add insulin Lispro. Add whatever you're using here because it is going to give you key information about your medication. All right, so I am clicking on keep the brand. I'm adding it to my drug list. I've added Novolog, which is another insulin. I've added Wegovy, which is a weight loss drug, and I've added Losartan, which is a medication for hypertension or high blood pressure. All right, now I am done adding drugs, so I am clicking here and I'm going to move on. You can choose up to 5 pharmacies to search. It is very important that you know what is in network for your plan and what isn't. I have selected in my area a Kroger, a Walmart, a Publix, a CVS, and the mail order pharmacy. There will be mail order options with all of your plans. So you definitely want to make sure you're doing that. So I am done adding pharmacies. You can add healthcare providers here. You know what? I will add mine just so that we can see if she is in network. She's internal med, so yes. And I'm just going to continue to view my plan. All right. So here, the screen that populates once you finish adding your providers, it says choose a plan to join. My plans are showing for plans that I'm eligible to join if I am in Gwinnett County, Georgia. This screen will look the same no matter where you are. It will populate for your area. All right, so I do have an AARP, which is a United Healthcare plan. This is an HMO plan. This is Cigna Health Springs right here. You can filter plans by your provider. So I'm just going to tell you, if you love your doctor, you want to make sure you click this screen so that you can see all of her plans. I'll do that just to see what happens. All right, so with her, I now have Aetna plans that populated. So I have Aetna Medicare and HMO. I have an Aetna PPO. I have Humana. I know I'm scrolling quickly, but I'm trying to get through this so that I can show you all everything you need. I do have a Kaiser Permanente, additional Humana plans. I'm going to keep scrolling. Let's see, guys. I have more Humana plans. Let's go down here. I think that this is interesting. So when you select your provider, it does limit. You don't see all the plans. You only see the ones that your doctor is in network for. However, I am going to take her off, and we are going to look at the plans again. And now the United Healthcare plans have come up. We have 58 options without her being selected. And it does show us 10 at a time. All right, so at the bottom, I do have two plans that I want to compare, which is the Clear Springs Health Bright Path Advantage. It's an HMO plan. And I also have a PPO plan that is by Clear Springs. So let's compare the two. And here we now have them populated side by side. We have their star rating, which for Clear Springs, this is a 1 out of 5, and right now showing 2.5 for this plan. And for the HMO plan and for the PPO, it says not enough data available. So I'm not sure if the PPO is a new plan or if it is, if there just really isn't enough data. It does show you the health deductibles, which is 0 for both plans. The drug plan deductible, which is $400. That's for your medications. The maximum that you'll pay for health services with the HMO is $4,200 in network. With the PPO, it is $6,751 in network, but it is $9,250, which appears to be a combined in and out of network. Out of pocket. For your premium, you will not pay anything additional. There's 0 there for your drug premium. For both, it's 0. Now, your standard Part B premium, it has $185 for both. Here's what I want you to do. Click here if you don't understand what the standard Part B premium is. Once you click this link, this populates over here that explains what the standard B premium is. And you can just close it when you're finished and go back. There's also a Part B premium reduction, which with the HMO plan is $1.40 reduction. With the PPO plan, that's not offered at all. Again, you click the link, this will populate, and this tells you all the information you need to know about the Part B premium reduction. All right. Now I'm going to close this and we'll just look at the plan features. Both plans offer vision, dental, and hearing. The HMO offers transportation. The PPO does not. The HMO and PPO both offer fitness benefits and over-the-counter drug benefits. They both offer annual physical exams, telehealth, endodontics, periodontics. The HMO offers, again, the Part B premium reduction. The PPO does not. So anything with an X, if it's something you need, you may need to keep shopping. Okay. And then we have the area that is benefits and costs. So primary doctor visits, you pay $0 in network. But notice over here with the PPO that if you are out of network, you have a 45% coinsurance. That is almost 50% of what it will cost to see that doctor. For your specialist visits, you have in network, it says there's a range of $0 to $35 for the HMO plan, but the range for the PPO is $0 to $25. That is something that you definitely want to check on. Diagnostic tests and procedures. There's a $0 copay for both plans. But out of network for the PPO, you have 20%. So this is really what I want you all to pay attention to, just how things vary. Diagnostic radiology services like MRIs, here Clear Springs clearly says that you have an in-network of $0 to $100. And that is for both the HMO and the PPO. You're going to pay somewhere between $0 and $100. If it's an MRI, any nuclear med, maybe even a CT, you will most likely be paying the $100 copay. This area is often overlooked, and this is, I don't know if you've seen my other video. You do not have two insurances, you have a Medicare Advantage plan, but this is what confuses people the most. They think, or I don't know, we tend to think that I have Clear Springs and Medicare. Yeah, no, not how that works. You elected to have Clear Springs to manage your Medicare. So Clear Springs dictates how much you pay. And radiology services are often overlooked. If I have time, I'm gonna go back because I want to show you all maybe what Humana or Aetna have for theirs. But you definitely want to check your benefits. You see for outpatient x-rays, it even says $0 to $100. If you have emergency care, that's $120 if you go to the emergency room. $115 with the PPO plan. Your urgent care is a $65 copay to go to urgent care, and a $40 copay with the PPO plan. These are the things I want you to look at so you won't be surprised when you get those bills or you walk up to the counter and they say you have a $65 copay. Outpatient hospital coverage is $250 as long as it's in network for both plans. And your preventative services, you are not paying anything when you check in. Okay. There are extra benefits. This is also an area of confusion for a lot of people. This plan offers prescription hearing aids, but it does not cover over-the-counter hearing aids. So that's something you need to know. There is preventative dental on this plan. There's also comprehensive dental. Comprehensive dental is not covered with every plan. And sometimes you may run into areas where there may not be preventive, but comprehensive is not covered all the time. There's extra benefits. You want to look under this area. There's skilled nursing. It talks about eyeglasses, durable medical equipment. This is your wheelchairs, your oxygens, your CPAPs, all those nice things that we're using. As you see, it saying that there's a 20% coinsurance that applies. That is whether it is the HMO or the PPO. But these are the things that I want you to look for when you're comparing plans. And you can compare up to 3 plans at a time. I will try to quickly show you that with maybe a Humana plan. Drug coverage and costs, as you see here, it's showing you that all of these are preferred and that the other one is Publix is in network, but Kroger, Walmart, CVS, mail order, they're all preferred. Click the link and it'll explain how the pharmacy networks work. As you see here, preferred means that they usually offer the lowest cost. In network means usually offer drugs for a lower cost than out of network pharmacies, but a higher cost than preferred in network pharmacies. That's something you need to know because that means that Publix, you may pay more than what you pay at Kroger, Walmart, or CVS for this plan. All right. And mail order, the cost varies. If it's out of network, the drugs are going to be at a higher cost. So that's something you should know up front. All right. So this is how you compare plans. Now, what we're going to do is go back here to the results, and we're going to try to find, let's see if I can find the Aetna plans. Sort plans. Wonder if it'll tell me. Yeah. Okay, insurance carriers. So we're going to go here and we're going to look for Aetna Medicare. And let's see if it populates. Okay, we're going to hit apply. And the Aetna plans populate. This is an HMO. And there's 2 PPO, 3 PP, 4 PPOs, guys. There's a lot of PPOs. All right, so this is what we're going to try to do. We can only compare 3 at a time. So I'm going to compare one HMO and 2 PPOs. Let's kind of see. And see, here it's showing me that my provider is in network. Trying to see if I can find one that may be nice enough. All right, so we'll compare this one at the end. I'm just selecting random plans here. But what I really want to go to, and as you see here, the star rating for Aetna for all of their plans is a 4.5. All right, now there's some clear differences here than what we saw with Clear Springs. With Aetna, we have 0 for health deductibles. We have 0 with this HMO plan. We have a $350 annual deductible with this PPO plan, and $0 with the plus plan. With the drug plans, we see $615 with this first HMO and PPO. Now, I don't want to harp on that. We've kind of walked through it, but I do want to go down to the diagnostic testing. Here is the area that I want you to pay the most attention to, because I think that it gets lost during this time, benefits and costs, because this is what you're going to pay out of pocket. Now, this is Aetna, and for radiology services like MRIs, it is very clear. It tells you here that you're going to pay between $0 and $300 as a copay. For diagnostic tests and procedures here, it tells you that you're going to pay between $0 and $95. That is with the HMO plan. That is actually for the diagnostic radiology, that's with everything. It's with the HMO and the PPO plans if we are looking at the screen. Now, that is for in-network. If you're out of network with this PPO, you're paying 50%. And then with this one, you're paying 35%. 50% is a lot. Depending upon where you're having this service performed, 50% is a lot. The benefits and cost is the area that I want you to pay attention the most when you're comparing your plans. And if you're not comparing and you have an agent that's calling you and they're walking through it with you, I want you to ask them. Ask. Let's just say, let's have a conversation about my benefits and costs, because I want to know what my out-of-pocket responsibilities are going to be. This is something that you all need to know. The extra benefits, everything is here. You know how to search for these benefits, but if you don't do anything else, nothing else, I want you to check your benefits and costs. I have a little time, so I'm going to go back and pull up the Humana plans because I want you all to see that. Let's go up here. We're going to go back to plan results. And we are going to remove Aetna here. And we're going to go to Humana and hit apply. And okay, so Humana started with a PPO. Oh, I have to take all of these off. All right, so we have a Humana PPO. Just want to give you all an idea of what's being missed when you're selecting coverage. And we don't want 2025 to look like, we don't want 2026 to look like 2025. All right. Let's see. This is a regional PPO. So let's click on this one and we're going to see what the differences between these three plans are. And I know you know where I'm going. Humana has a 4.5 rating for this PPO plan. They have a 3.5 for this HMO and this regional PPO. As you see, there's differences here in the overview area, but we're going to go down to benefits and costs. This is what I want you to see the most. For diagnostic radiology services like MRIs, there's a range of $0 to $335 for the copay. This is in network. This is just the copay. This is a copay. You're going to pay this regardless. Okay. So when the registration team calls and they say, hey, you have a $200 copay, or this is the information that they provided to us. This is why. This is the part you didn't understand when you selected this. And this is the part I don't want you to miss out on anymore. Okay. So I do want you again to go to the benefits and cost area when you are comparing the plans, because that is the information that you need more than anything. As you see here, I mean, your copays can range from $0 to $335, but you don't even know that because no one told you that when you were selecting this plan. They probably said, oh yeah, you're going to have hearing and vision and or dental, but they told you were going to have dental, but they didn't tell you that you wouldn't have comprehensive dental. Now with this plan, you actually do have comprehensive dental. That's a really good thing, as you see, but that's something that you need to know. All right. Now I am actually going to, I just found something really good and then I'm going to move on. But here with this Humana regional plan, it's showing you that all of the pharmacies I selected are out of network. All of them are out of network. And that the preferred pharmacy is the mail order pharmacy for the other two plans. So that means you're going to get your greatest cost with those mail order pharmacies. The other ones are in network, but they can charge more because they're not preferred. That's something that you need to know. All right. Now, before you make any decisions, I want to walk you through a few things to look for while you're researching these plans. And remember, you don't have to pick the first one that looks good. Take your time, compare several, and make sure that the coverage fits you. No one else, just you. I want you to make sure you have what you need. The first thing I want you to do is to research multiple plans. Start by reviewing just maybe 2 or 3 different plans. You may find one that has a lower premium but higher copays, while another one includes dental, the comprehensive dental and vision benefits. But the goal here is to make sure that you see the full picture before you decide on which plan you're going to choose. Secondly, I want you to review the benefits and cost carefully. Now look closely at this section. because I do feel this section is often overlooked, and there's surprise. Well, I'm not going to call them surprise copays, but there's copays in there that you all may not realize are there, and you get that surprise bill after the fact. So don't just stop at the premium. Click into the plan details, review those copays and coinsurances for important services like diagnostic imaging, specialist visit, urgent care, emergency care. These areas can lead to big out of pocket costs later on if you ever need testing done. So it is worth it to read the fine print ahead of time. Third, I want you to check your dental coverage. Review the dental benefits carefully because some plans offer preventive only dental, which might just cover cleanings and exams. Some of them do include the comprehensive coverage like fillings, dentures, or crowns. You need to know this up front. A few are going to include both, but the limits and copays can vary widely, and it is very important that you know what's being offered before you select the plan because dental health is important and you need to know this information. All right. Fourth, I do want you to make sure you are entering your medications and pharmacies ahead of time because the medications that you take monthly and the preferred pharmacies can save you money if you know I'm taking this medication and this pharmacy is going to cost me less than this pharmacy. You need to know that information up front. It'll help you to plan for 2026. Um, Very cost effective. There, make sure you're entering your medications and your pharmacies. Um, it's just going to give you an estimate of your yearly outlook, and trust and believe even $5 for a medication can add up over 12 months. This is where you're going to find your savings. All right. Now enter your providers as well, but make sure you're entering them um, so that you can find out whether or not they're in network. As a tip, I do suggest that you check your plans first. Enter your providers, but don't search the plan that your providers are covered under. I do want you to search the plans without your provider being covered under the plan because you need to find the plan that's the best fit for you first. Now, I do want you to go back after you found a plan that you think works to see if your provider is covered under that plan. Okay, because if you add them at the beginning, it will limit your plan options, and you may not see a plan that may be the best fit for you. All right, six, I want you to create an account because if you go on and create an account on Medicare.gov, then all of your information is going to be there. Remember, it's completely free. It saves your information, your medications, your preferred pharmacies, your provider searches. So the next time you log in, you can pick up right where you left off. It makes this enrollment process a lot smoother when you're trying to make choices. Just remember doing your homework now can save you a lot of stress. Yes, we are going back to school. We are still doing homework. But not only will it save stress, it'll save you money later on. I know that it's going to take a lot of time, but you are going to feel confidence with every click. In my next video, we will walk through how to compare plans side by side, specific plans, because this video just gives you an overview, but I definitely want to show you how to compare specific plans side by side. So stay tuned. Just remember that clarity creates confidence, and let's keep building yours together. If there is a specific plan that you want to see, just drop it in the comments, and I'll create a video and we'll walk through it. All right. Y'all enjoy. Bye bye.